I love my job because it is all-encompassing. It fills me up. It's intellectually challenging, it's technically challenging, but it also is something that on every day I know I'm doing something that means something that's important. I'm a person who feels compelled to help other people, and I really enjoy seeing people feel better and get better. I'm trained as a cardiothoracic surgeon, so I do both heart and lung surgery. We've really worked hard over the last 10 years here at Moore Regional to offer state-of-the-art surgical therapy to the patients of this area. I sometimes think it's a shame that people think they have to go elsewhere or have to go farther away or somewhere that's less convenient, then they can just come here and get what I consider to be unrivaled care.
My journey with lung cancer started back in November of 2018. The cancer was in my upper left lung lobe, so I had heard good news about Moore Regional, and I came over here. I had got set up with Dr. Kitchens, and he said, well, what I'm gonna have to do is remove 1/5 of your left lung. But with the robotics, we're gonna make just a few little small holes. So they went in, and it was just amazes me, and I love to tell the story because it's fascinating. I hate to say it, but it's a blessing to be sick. If you got to be sick here.
In some ways, with Dr. Pritchett doing the innovative stuff that he's doing, we're ahead of the game. I mean, he's doing things here that nobody else is doing elsewhere. We're one of the first places to use a robotic bronchoscope to do biopsies, and we've held up our end of the bargain on the surgical side of things. We're doing robotic lobectomies here, which is a minimally invasive approach, and do things in such a way that the patients can actually go home 2 days after surgery, which even 10 years ago was unheard of.
Most doctors, when you have surgery, they may come in that day and see you, but you won't see them again for 2 or 3 days. Dr. Kitchens was there within an hour after my surgery. 3 hours later, he was back. 2 of his staff come in, checked me out. I was treated like I was royalty.
Here you're gonna see me. You're gonna see your doctor. We don't have medical students here. We're not training anybody. The person who's doing your operation is the surgeon whose name is on the chart. And I think the quality of what we do is excellent because of that. In places that don't have a multidisciplinary team approach to their cancer care, a patient might just be seen by one physician, and that one physician may just say, well, I'm going to treat this the way that I treat it. That's not what's best for the patient. If you're going to do what's best for the patient, you need to get everybody in a room, you need to get all that expertise together, and you need to have a collegial discussion about what is best for this person. One of the things that we're currently in the process of really trying to make more efficient is the process and the time it takes for somebody to go from the beginning of their cancer journey, which is they might have an X-ray or a CAT scan or something that shows a suspicious finding, to the end, which is the end of their treatment. Ideally, you want to have that be the shortest period of time possible. Now, without a dedicated building, a cancer center, everything under one roof, it's a challenge to say, have the patient get their CAT scan over here, then they have to get their PET scan over in this building, then they have to see this physician whose clinic is in this building, and then they have to see another physician potentially whose clinic is in this building. Every time you have to go to a different place, that's a different appointment, that's a different day, and everything gets dragged out.
My experience with initially coming here was I had to go to one building and get an X-ray. Had to go to another building and get a CAT scan. Moore Regional is a great complex, but my opinion, I think what would help out if it was all into one area.
You can put that all under one roof, you're going to make things much more efficient. You're going to be able to see multiple physicians in one day. You're going to be able to get scans potentially in the morning. You might even be able to get your tests done. I mean, so everything can be done in a much more compressed time, and that's just going to clearly be better for the patients. Getting everything under one roof is going to be huge.